All right, we're here with Andy Revkin from Pace University and the New York Times. Just hosted a panel on healthy living and sustainable life. A lot of the focus so far has been on changing mindsets and changing norms. How effective do you think we've been so far in this country in doing that?
Well, I think what was impressive about Howard Koh and Bob Perciasepi was their focus on the shifting baselines. In other words, there's been a lot accomplished, that many communities in this country are way more livable and breathable than they were a couple of decades ago, but it's been incremental. And the question is, how do you sustain that pattern, and what can you do in communities where there really are deep problems, sometimes related to poverty, and it's tough. Especially these guys are federal agency people, and so much of this is either state or local decisions that make the difference. And so they have limited capacity. That's why the country has areas where you have deep pockets of either severe local pollution or everything from obesity to other kinds of health problems. Really, there are real challenges still.
Do you think a lot of this boils down to pure politics, where people already think they have a mindset made up, whether they really look at the issue or not?
Well, a big chunk of it boils down to economics. Economics of what kinds of investments or changes do you want to make now to limit, again, as many of these impacts are indirect, like small particle pollution. You can almost not see it in many cases. It's not like traditional sooty, dark pollution. So convincing people that making a power plant more efficient and less emitting has health benefits, even that is hard sometimes, because it's not visible, and it's only visible in the statistics, as was said. People say, "Well, where's the bodies? Why should we be investing money to avoid deaths that you say are happening, but you can't show me that." That's another challenge.
What do you think is the next step in terms of changing people's minds?
Well, I'm a communicator, and even at Pace University, it's all about what can we do with these new communication tools we have to foster, mostly from the bottom up, and cheaply, real interesting new ways to tell the story, to define public health, to make that visible and tangible, to make numbers meaningful emotionally. There are great opportunities there for students in communication and graphics and animation and the arts to play a role. And I think that really is because as this famous sociologist Paul Slovic talks about the feeling of risk. Most of our reactions and decisions on risk are based on our emotions, not some numerical calculation. So there's great opportunities.